Hey guys, welcome back to my channel. Today's discussion is AOGD February bulletin. Okay, so in this first topic is the adolescent health, which is a foundation stone for the bright nation. So we all know who are adolescents. 10 to 19 years people are adolescents, and the word adolescence came from adolescere, which means to grow up. Okay. Adolescence is again divided into early adolescence, middle adolescence, and late adolescence. Early is 10 to 13 years, late is 14 to 16 years, and 17 to 19 years is, middle is 14 to 16 years, and late is 17 to 19 years. Okay. So how it is dependent means it is like in 10 to 13 years, there is rapid growth, development of secondary sexual characters, all takes place in early adolescence. And in middle adolescence, they are like they form a separate identity from parents. They start making friends. Okay, they like to do experimentation. And late adolescence is their solidification of identity, well-formed opinions and values are seen. Okay, in India, there is a program known as RKSK, that is Rashtriya Kishore Swasthya Karyakram. This is mainly enhancing the adolescents' friendly health clinics. These are basically the facility place strategy. Okay, so even the adolescent and sexual health clinics aimed in offering the counseling to the sexual and reproductive health matters. Okay, basically, what this RKSK program is, it should be equitable. The services should be equal to all adolescents. It should be accessible. The even the sexual like reproductive transmitted infection center should be accessible to the adolescent. It should be acceptable. It should be appropriate. It should be effective. And it should be comprehensive. Okay. So why we are more concentrated on adolescents? Adolescents are also normal human beings. Nah? No. There are some common adolescent problems. First thing, mainly in girls, there is menstrual abnormalities. Like there can be primary amenorrhea or secondary amenorrhea, heavy menstrual bleeding, puberty menorrhagia, oligomenorrhea, premenstrual syndrome. They can see dysmenorrhea, pelvic penis. Some people have white discharge. Some people have teenage pregnancy, unwanted pregnancy. Some have hirsutism. Some have diet problems like obesity or less nutrition like anemia, precocious puberty sin. Some have congenital uterine anomalies, sexually transmitted infections, contraception, and sexual abuse. Okay, not sexual abuse not only to the females, even the males can suffer with sexual abuse. Okay, these should be addressed. These are common adolescent problems. Okay, so basically, the indication of gynecological examination is if there is any vaginal bleeding, if there is some delayed puberty, persistent vaginal discharge, primary amenorrhea, cyclical pain, suspicion of any vaginal neoplasm in adolescent, then we should go for gynecological examination. At least we should do inspection. Okay. So menstrual abnormalities is generally the NICE guideline says that the heavy menstrual bleeding is excessive menstrual loss which impacts the quality of life. Okay, the person will be changing the sanitary pads 1 to 2 hours, and when menses last longer than 7 days. Okay, so generally, typically the menses is 2 to 7 days. If it is less than more than 7 days, then it is heavy menstrual bleeding. Okay. Once the adolescent attains the menarche, 50% of menstrual cycles are anovulatory, then 75% becomes ovulatory regularly. Okay, because the HPA axis is immature, it will be adjusting in that period of time. So, why there are menstrual abnormalities in adolescents is it can be because of hematological, like there is any clotting factor deficiency or von Willebrand deficiency, factor 8, factor 9 correlation defects, hemophilias. Is there if the patient is Jewish descent, Ashkenazi Jewish descent. Other thing is endocrinopathy, hypothyroidism PCOS, connective tissue disorders, endometriosis, chronic systemic diseases like type 1 diabetes, hyperinsulinemia, secondary to ovarian insulin resistance and type 2 diabetes. Medications like if that lady, if that female is taking any anti-epileptic, antipsychotics, these enzyme inducers decrease the potential of oral contraceptive or oral progesterones, leading to breakthrough bleeding of contraception failure. If the adolescent is taking contraception, then these medications can affect and can result in heavy menstrual bleeding. Okay. Next is vaginal discharge. Why there is white discharge in adolescent? Because white discharge can be grayish white, non-purulent, thick. Irritations can occur. Okay. Asymptomatic They need to change the frequent undergarments. Okay, microscopic examination, we can see sheets of vaginal epithelial cells. Why there is excessive vaginal secretion? Because of estrogenism, malnutrition, or ill health. Okay, if there is any cervical erosion, if sexual excitement or masturbation also should be seen. Okay. Common cause of abdominal lump is 12 to 18 years. It can be pregnancy, urine retention, ovarian tumors, or uterine tumors. It can be hematometer. This is very important. Okay. Now coming to the topic, and is teenage pregnancy. So teenage are risk of having pregnancy because if they have teenage parents or lower socioeconomic status, sexual abuse, in that way. So risk associated are if a teenage one is becoming pregnant, there will be small for gestational age baby, there is hypertension, there is sexually transmitted infection. Okay. There will be neglect by the parents, low birth weight of that small child. Okay. So how to prevent teenage pregnancy? First, we should educate them. We should improve the contraception. If they're already sexually active, we should introduce contraception. We should educate the parents. Component prevention, and youth development should be done. What is menstrual hygiene? Menstrual hygiene is like we should develop that some people will be using the uh, cloths and all. So for them, the government of India brought this menstrual hygiene program under um, Ministry of Health and Family Welfare. The scheme is also supported by National Health Mission. Okay, this is to provide a sanitary pad like in a cost like rupees 6 per pack. One packet will be given at the rupees of 6. This is distributed by Asha workers. Okay. Um, Foxy says that when to change the pad, like we should, like if you are taking a shower, then you should change the pad. Okay. Then change the pad if it is completely soaked. How you will know that it is completely soaked? If the edges are already soaked or within 4 hours, then you should change the pad. Okay. And whenever you change the pad, you try to clean the faucet area. Okay. And clean with the faucet. Okay. Then use tissue or wipe off the water before putting a new pad. Then uh, some cloth pads are there. If you want to use it, reuse it, keep it in a plain water until the stain dissolves. Then wash with warm soapy water, rinse and dry under bright sunlight. And after completely dry, the moisture free, then you can use that. Okay. Uh, dispose the air if you want to dispose of sanitary pad, dispose in an airtight plastic bag or in a newspaper, then dispose it off. Okay. Mm, um, biomedical waste is being produced because of continuous production of waste. So better to use reusable sanitary napkins. Okay. That is one problem. Menstrual hygiene is one of the problem in adolescents. Coming to anemia, anemia is also a problem. So that's why they brought this Anemia Mukt Bharat program, which is 6 into 6 strategy, where you have children of two age category and even adolescents is present. One of the categories adolescents. Okay, then women, reproductive women, pregnant women, lactate women. This 6 into 6 strategy have 6 beneficiaries, 6 interventions, 6 institutional mechanisms. Okay. So providing the tablets, deworming, then behavioral changes, texting of the anemia using digital methods, testing, I mean, then providing this fortified food, addressing the non-nutrition causes of anemia, okay, in that way. And institutional mechanisms, you have National Anemia Mukut Bharat Unit, intra-ministerial coordination. So ministers are there. So intra-ministerial coordination should be present. Then strengthening the chains and logistics. Other ministries should be convergent. National Center for Excellence and Advanced Digital Anemia Control should be involved. Anemia Mukut Bharat dashboard or digital portal is there. One stop shop for anemia. Okay. So 6 beneficiaries are these, 6 interventions are these, and institutional mechanisms are these. Okay. Most of the people will forget how to write institutional mechanism. Remember unit, one ministerial coordination between the ministries, and strengthening the supply. The medicines or all supply should be strengthened. Then other ministries should be convergent. The ministries and other ministries should be convergent. Okay. Then you have a National Center of Excellence for Anemia Control. Then dashboard and digital portals should be involved. This is Anemia Mukta Bharat program. Then coming to sexually transmitted diseases in adolescents. So these are should be prevented by initial questionnaires and all. Then puberty problems like if puberty have like hyperandrogenism, if there is any mild degree of gonadal hyperplasia, gonadal dysgenesis, and adrenal insensitivity in androgen insensitivity syndrome. If there is acne, acne can be resulted because of hyperandrogenism, so we should rule out PCOS in them. Then coming to problem like the obesity in adolescents, so diet is one of the problem. So some people, mainly adolescents, they'll get a little chubby. So most of the parents and even the relatives will be saying she's growing very fat. Try to cut down some food. So a big no for that because some of the foods are very essential for them at that age of at that point of age. So you should say yes to these foods like milk and dairy products, green vegetables, fruit cereals, soups, juices, regular meals, and balanced diet. You should involve 40% of calories having carbohydrates. Okay, and calories should be maintained at 1500 to 1600. If you want to cut down, maintain this calorie levels and give these foods. Don't say no milk, no non-vegetarian food, not like that, okay? In that way. Then mental health should be monitored. Then suicidal thoughts are more common in adolescents. So families of suicides, then it should be evaluated. There is a patient health questionnaire so that if you do that, we can find out that this person is having the thoughts or not in that way, okay? Sexual education is also very important. Okay, school health and wellness program. This is very important. There is a program was given is a part of health and wellness component of Ayushman Bharat program. Okay, this says that there are two teachers, one male and one female teacher in every school. These teachers' main work is every week for 1 hour they'll take a class about health. Okay, health promotion, disease prevention, about 11 thematic areas they will cover. Okay, this is mandated in every school. So key points is 10 to 19 years are adolescents. Then you have Rashtriya Kishore Swasth Karyakramam. Then you have common adolescent issues which I already told. Preventive measures like iron supplementation and deworming and proper diet. Obesity related complications like PCOS should be educated. Conclusion is we create an environment where adolescents feel safe and comfortable discussing sensitivity issues like sexual health, mental well-being, and risky behaviors. Okay, so I felt in this topic more important is Anemia Mukta Bharat program. Okay, 6 into 6 strategies, where 6 beneficiaries, 6 interventions, and 6 institutional mechanisms. Where institutional mechanisms you have 8 unit, then inter ministries coordination, then you have convergence of other ministries, then you have supplying the drugs and logistics to be maintained, then you have National Center of Excellence for Anemia Control, then you have digital portals. Okay, these are 6 institutional mechanisms. Next, coming to what is POXO Act and what is how it is child-friendly justice. So in this, after reading this act, I felt like even the male child who is less than 19, okay, these are also they also come if they are under sexual abuse or sexual harassment, that also come under POXO Act. Okay, so POXO Act is 2012 it came. So it is recognizing the human unique needs and vulnerabilities of young ones. Okay. Mm, so basically, any person who is below 18 years, so Foxhoid is 18 years, even it is male or female, remember that thing, okay? So 18 years, it defines as different forms of sexual abuse like penetrative or non-penetrative assaults, sexual harassments, pornography. It can be aggravated in certain circumstances, okay? Mentally ill people, even 18 years female who is mentally ill also comes under POXO. Okay. Position of trust and authority of child like family members, police officer, teacher, doctor, whoever do this abuse comes under POXO Act. Okay. So this is very important. This is a gender neutral. Even the boys and girls are victims or survivors of say rape or sexual assault. They come under this act. Okay. So all kind of sexual offences like assault, harassment, pornography comes under this act. Then who can file a complaint? Like false complaint, humiliation, the person is liable for punishment under this act. But the case of penetrating sexual assault can be filed against only men. Only men of penetrative sexual assault, only men get accused. What is sexual abuse? Okay, like penetrative abuse, like sexual oral sex, or this thing non-penetrative abuse, like exploiting with pornography purpose, is a sexual abuse. Sexual harassment does not include the physical contact, but consider the verbal acts, pornography, or constantly following or watching a child, threatening child, using a depiction of child involved in sexual attack, okay, act and entitling the child for pornography purposes. These are all comes under sexual harassment. Coming to gradation of sexual abuse, I already told there is aggravated penetrative sexual act assault and aggravated sexual assault, uh, where it is divided. So provision of special courts should be given for POXO Act, and trial under this act shall be conducted in camera, like only the girl and the judge and prosecutor will be present. Okay. Then special court is expected to complete their trial within 1 year of taking the cognizance of case. What's the role of police to ensure the child-friendly atmosphere? First, if there is any POXO case happen, first you should get a FIR. And it should be given free of cost to the person making the complaint. And police should inform the child or parents in whom the child has trust or confidence. Parents should inform the parent or guardian in whom child has trust or confidence. And FIR should be recorded in the simple language. Report is recorded in the language not understood by the child, and interpreted or translated should be used. Emergency medical care should be given. Medical examination should be conducted irrespective of FIR. It is very important. Child should be taken to the hospital for medical examination. If the girl child and female doctors should be present. Medical examination of child should be done in the presence of parents or the person whom the girl child trusts. Child statement must be recorded at the child resident or at a place where the child usually lives or a place of choice. While recording the child's statement, the following information should be taken by the police officer, and the report, like his or her name, the address and telephone number, the name and address of the contact details of the officer who supervises him. Okay, these should be taken. The child's name, address, and also the officer's name and address. The statement is as far as practicable to be recorded for a woman police officer not below rank of SI. Okay, SI officer can be will be following this case. And in the presence of parents, the statement of the child is recorded, and interpreter can be used if the language problem, and special educators or persons can be used on the manner of communication. Medical examination should be done by the if the girl child and female doctor will be taking out, and victim compensations can be established. Special courts are there for this POXO Act. Every special court should include 3 rooms. One room is court sits, and the other room the child where the child deposes. Another is child waiting room. Okay, child will wait in one room, and they'll call in one more room. Another room the judge sits. Video conference or video link between the courtroom and child's room is there. The child can identify the accused by entering into the courtroom, but for the limited purpose. Okay. Then, in addition to the standard court procedures, recording testimonials, the child deposition should be recorded. Child choosing to depose directly before special court shall do. Like curtains or one-way mirrors can be used. Okay. Um, Child may allowed to depose from the place other than the witness box. Testimonial aids can be used, like using dolls can be explained, anatomically correct dolls, puppets, drawings, mannequins. These can be used in special courts. This is the child during this disposition. Okay. Conclusion is we should create forums where child can children can be given information support in the village, like school teachers, Anganwadi teacher, workers, ANMs should be educating the child that what is a good and what good touch and bad touch in this thing in this way. Next is sexual health. Sexual health is very, very important in adolescents. Like we'll miss this, okay? Because they get a minarchy and no one will be caring about, no one will be teaching them what is sexual health, okay? So listen this. So adolescents are prone to high risk sexual behaviors. Okay, like sexual transmitted infections are very prone because the nutritional status is not adequate. They're more prone for sexual transmitted infections. Okay, and if they are following sexual intercourse without knowing what are the consequences. If a young woman is getting pregnant, then will be withdrawn from the school. There is no studies. Okay. Um, if some people like physically and mentally impaired people get pregnant, some are being human trafficking being done in that way. Okay. So counseling about STIs is a critical point here. So empowering the young people to know and exercise their rights is very important. And if for example, one 16-year girl comes to you and she's saying that I'm sexually active, I want a contraceptive method, give her contraceptive method. Teach her what is right and what is wrong, and first initially give her contraceptive method. Don't say that why are you having sexual intercourse in a young age of time. That is that is no sense because she is already doing and she will do after that also. So better go for good contraceptive method and educate her about what are the infection, what are the signs and symptoms and all. Mm, even parents and guardians who are present with adolescents should talk with the teens about sex, pregnancy, contraception, STIs. They should talk. Okay. Then, if they are because we can prevent so many things like adolescent girl if they are getting pregnant, then underweight babies, stillborn babies can be born. Okay. Then contraception should be educated, as I already told. Mutual respect boundary should be given. Like adolescents, they're small. You should not disrespect them. Okay, you should give a mutual respect to them. Last is next is psychiatric morbidity. Like in PCOS people, there is psychiatric morbidity in them. Like because they are more prone for obesity and acne, they have that concept of self concept, body perception, self esteem is disturbed. Stress also is present in adolescents, which stress can result in adverse metabolic and reproductive outcomes. Stress hormones like cortisol and DHA with PCOS are found in increased amount and it aggravates PCOS features. Even sleep is deprived hormone imbalance, insulin resistance can result in sleep deprivation. Okay, even obesity can result in sleep apnea and PCOS can increase. Increased sympathetic activity like increased sympathetic nervous system activities in PCOS. These also can result in insomnia. Okay, these adolescents generally have decrease in the REM and NREM sleeps. Okay, depression is seen is almost 2.4 fold increase in depression. Actually, what is depression? Lack of interest and all in adults, but in adolescents, depression like there will be depressed mood. Sometimes there is increased reactivity in mood, anxiety, school refusal, behavior problems. Okay, academic decline is seen. Okay, in that way. Pathophysiology, there is serotonin, dopamine, GABA, acetylcholine, which is reduced. Okay. Um, then associated factors which increase because of weight gain, acne, there is increase in depression. Bipolar is also seen in case of adolescents, severe emotional lability is seen. So early screening of bipolar disorder in adolescents with PCOS is recommended. Sodium valproate is a mood stabilizer. Anxiety disorders like palpitation, sweating, shortness of breath is seen in adolescents. Okay, obsessive compulsive disorder is seen. Obsession resulting in repetitive actions known as compulsions is seen in 2%. Psychotic disorders like hormonal imbalance can cause psychotic disorders. Neuroendocrine dysfunction can cause psychotic disorders. Metabolic syndrome like abdominal obesity, hypertriglyceridemia. These results in important issue in case of PCOS. Maladaptive eating habits is a feature of depression, and societal negative thoughts can also be seen because of body image coupled with psychiatric factors. Quality of life is affected in case of PCOS. So, conclusion screening for depression and anxiety is very important in case of PCOS and adolescents. Last topic of this AOGD bulletin is media addiction. We all know that as it is a internet era, there are so many platforms on social media. There is social media addiction in adolescents and high instances because of psychological vulnerability. Like these people won't see media, but the friends or peer groups will be seeing something and they'll be discussing. So they want to have that social comparison. and they want to have that they have that fear of missing out. Something they are missing out in social media, so they will see and see and see. Psychological factors are affecting peer pressure and social norms are they even platform designs. Okay, so key characteristic of social media and addiction is excessive time they are spending on online. Compulsorily, they will check the notifications and update. Neglect on real life responsibilities. Neglect on emotional impact. Okay, their influence in social media is so much that they express the anxiety and depression. They they are when unable to access social media, they'll express this anxiety and depression in them. Difficulty in disconnecting, escapism is seen. Positive effective of social media have a positive effect, like they can talk with other people, social connectivity is there. There is access of information, they can learn about new technologies and new skills. Self-expression is seen. Okay, negative effect is eye strain, sleep problems, poor posture, and obesity. Psychologically, there is addictive behavior, anxiety and depression is seen, span is reduced. There is cyberbullying, like if they keep any comment or if they keep any post, there is cyberbullying of that person. Body imaging and social comparison is seen. Isolation, because of this, there is effect like isolation, academic decline, there is impaired communication skills. Treatment is we should discuss the issue, educate about the risks. Setting the boundaries like screen time limits should be given, time management tools should be created. Encouraging the healthy digital habits like schedule the break, device-free zones, and mindful social media use. Promoting real-life social interactions, hobbies, and so like you should meet persons in real life. They should create other hobbies and interests. Okay, volunteer these activities. Cognitive behavioral therapies like root causes should be addressed. Behavioral modification, improving the self-esteem. Family involvement like role models, family-based strategies, consistent monitoring should be done. Digital detox should be done. Gradual detox can be taken, like weekly once they can stop using social media. Group support, peer counseling should be done. Professional counseling like therapy support, family therapy can be given. Medications, in severe cases, they can give medications. Okay, so every fifth person is an adolescent that prone to this adverse media effect. Key points is parents should also be getting educated. Okay, family support and peer group support should be given. Offline solutions should be encouraged. Okay, that's it. Thank you.